Ankle sprains are one of the most common injuries people sustain, with about 23,000 occurring in the United States each day. The injury includes twisting the foot below the leg beyond its normal position or range of motion. This results in an injury to the ligaments or even the cartilage. Most people are aware of how to treat this immediately, with rest, ice, and compression. However, as many as 80% of ankle sprains end up with continued symptoms and problems. This can include lingering pain or instability, as well as lack of balance. If you have an ankle sprain, getting off your foot and icing is the first thing you should do. An evaluation by a podiatrist is the best way to avoid chronic problems. Treatment options for ankle injuries can include bracing, anti-inflammatory medications, injection therapy, physical therapy, as well as surgical intervention. If you have sprained your ankle, come in immediately for treatment to avoid chronic pain.